Hello, my name is Vanessa Bichelli. I'm the president of CareVitality, a subsidiary of EHR and Practice Management Consultants. Since at one time I was almost going to become a physician, the most important aspect of our organization is to help save lives. We are focused on the patients and the providers, and to us, the most important cost is the loss of a human life. We understand that on average, the U.S. spends $2.8 trillion on healthcare every year, most of which is spent to treat chronic illnesses. Many of us in the healthcare industry are aware of such devastating realities, like the fact that cancer and heart disease account for 50% of the deaths across our country, and the rate at which diabetes continues to increase year over year. In our current landscape, creating proactive solutions is the only way to combat the problem, create efficiencies, and cut costs. Healthcare is not as accessible, easy to navigate, or understand as many are led to believe. There are challenges to delivering healthcare for providers, but there are challenges for patients as well. The spirit of the Chronic Care Management Program is to bridge the gaps between providers and patients. Beginning at the start of January 2015, Medicare released the code 99490, reimbursing providers for non-face-to-face care coordination services furnished to Medicare patients with multiple chronic conditions. The 99490 code on average reimburses providers $43 per patient per month, depending on their physician fee schedule. According to MGMA statistics, that could mean almost $300,000 per year in gross annual revenue for providers able to identify 600 qualifying chronic care management patients. CMS recognizes the numerous studies conducted over the last decade that demonstrate that care management provides these patients with the much-needed support to improve quality outcomes and reduce total cost of care. There are, however, several challenges that have prevented many providers from participating in the Chronic Care Management Program. Unfortunately, according to the National Chronic Care Management Survey, released at the end of 2015, although 35 million Americans qualify for the program, only 100,000 patients were currently enrolled in the Chronic Care Management Program. This survey confirms our own experience working with providers and the numerous national and state medical society and association partnerships that we have, that providers are interested in participating in the Chronic Care Management Program, but had several concerns. Having to hire additional staff, insufficient reimbursement for time and resources, lack of awareness, and compliance concerns. An interesting revelation the survey revealed was that the majority of the early adopters were larger practices with 10 or more physicians. Smaller practices expressed the highest level of concern. The biggest barrier to adoption was the lack of awareness. Initially, this came as a surprise, but when I think back to several years ago, when the stimulus money was released to incentivize providers to adopt electronic health records, it made sense. Smaller practices face more challenges because they do not have the resources available to devote to adopting many of the incentive programs. Through our extensive research and experience working with providers to be able to implement the chronic care management services to their patients, we noticed several other key challenges, such as the burden of documenting the CCM activities appropriately and accurately within their EHR or other existing solutions within their office, identifying the CCM patients that qualify for the program, implementing an outreach program to sign the patients up for the program, lack of infrastructure to support the program, and the fact that many physicians are already facing burnout from being overworked and the fear this program will only add more work to their already overwhelming schedule. Fortunately, Medicare recognized these challenges at the onset of the CCM program, which is why they have allowed for third parties to provide these services to their Medicare patients. working as an extension of their practice or healthcare organization. As president of CareVitality, a subsidiary of EHR and Practice Management Consultants Incorporated, we have been providing technology services to healthcare organizations for almost 7 years. We have worked with over 150 EHR, practice management, and patient portal systems, and we understand the challenges practices face on a daily basis. We have for the past 7 years assisted practices in adopting technology and participating in incentive programs like PQRS, Meaningful Use, and Patient-Centered Medical Home. As a partner to many state and national medical associations, I have been asked to speak on the topic of the Chronic Care Management Program since its inception at the beginning of January 2015. Our organization created a comprehensive service offering to alleviate all the burdens providers typically face if they're implemented an internal CCM program. Our comprehensive service offering provides patient identification, patient outreach, customization of the practice's electronic health record if needed, training and implementation, as well as clinical care managers that are experienced RNs to provide the full scope of services to the practice's chronically ill Medicare patient population in order to bill for the 99490 code and document it in the local EHR to provide the necessary audit trails with a monthly report to document our progress. This is an excellent opportunity for providers and healthcare organizations to capitalize on an unprecedented revenue opportunity, improve the quality measures and outcomes for your patients, as well as improve the health of your patients and the wealth of your practice.